before you're going to have open heart surgery, before you're going to have a stent, if you've had a heart attack, there is an option. You don't need to have another surgery. You don't need to have another heart attack. You don't need to have another stroke. There is an alternative.
I was extremely heavy in lead, and I have no idea how lead got into my body. I obviously didn't eat paint that I can recall. I didn't chew on bullets, you know, but somehow I was off the chart as far as lead was concerned. So one of the early programs that they initiated for us was to begin a chelation regimen to help remove the lead.
So we have done a huge, what I think a landmark study. It's called the TACK trial. It was a trial to assess chelation therapy. And after 10 years, the study has just come out, and it has shown that yes, chelation therapy is A, safe to do, and B, it actually makes a big difference or significant difference for people with cardiovascular disease. This study has come out last week, and I'm very surprised to see that the media has not taken this in a positive spin. They have actually tried to diminish the results of the study.
So basically all the things we looked at, each individually was helped and overall was helped. So it was better than I had imagined.
So I started treatment for late stage prostate cancer. By that time I had thrown some blood clots into my lungs, and I was having really terrible shortness of breath. When I walked in here, I could walk about 10 feet dragging oxygen.
You can, stay on the medicines that we tested, we're right, but if you add chelation, especially in diabetics, 39% reduction in events. If you had a heart attack in the front part of the heart, 37% reduction. It's a huge numbers. On top of the therapy you're already on, people need to just know there is an option.
They suggested something that I'd never heard of before. They said, well, we should find out what caused this. And I've had various cancers for 7 or 8 years, and never has any doctor suggested that there's a root cause.
The study was designed to be the definitive result of chelation. One way or the other, we did the study as big as we could to prove it either worked or it didn't. We proved it worked, and now they're saying, instead of taking that and going, okay, let's start treating people, they're saying, no, let's hold off and let's see what happens. Now, it's 4 days later today. Even today, they came out with a roundtable discussion with 6 of the so-called experts of the American Heart Association to discuss the chelation study. Now, what's interesting in those 6 people is that none of them participated in the study. None of them do chelation. None of them really know what chelation is. So why would the American Heart Association present an expert panel with no experts on the panel as far as doing chelation or using chelation or having had experience chelation or even having done the trial? Over 130 centers were in the trial. Why didn't they interview any of us or any of the people in the study, or Dr. Lamas? At least he's the principal investigator, or any of the other doctors that were at the investigators meeting. Nothing. I haven't seen one of all the articles I've seen that were published the next day. I haven't seen one article where any of the people who did the study or our chelation experts were interviewed.
I think it is shameful that when you have delivered the Hippocratic Oath, which we all do at the end of our training, where you swear you will protect the life in front of you, and then you omit evidence, you omit the truth about things that can actually help, It's disgusting to me. I'm disgusted.
A lot of the articles immediately come out, you know, lesson learned. What is that? What about 26% benefit? You know, no to chelation message rings through. Why is that the conclusion of a study that shows a 26% benefit? Reduce death, reduce heart attacks, reduce hospitalizations, reduce surgeries, reduce stroke. And then you write that. That's, you know, cardiovascular business. Gee, you think that could have something to do with it?
I sense things are changing. And while I'm not totally cured now, I'm not walking with oxygen, and I can go a reasonable distance now that I couldn't go before. So it's just a matter of time before I'm going to be finally free and be able to breathe again and play some golf.
Don't cover my eyes, I just want to know. Don't cover my ears, I just want to know. Don't hide behind eyes, they just want to know. Don't cover my eyes, I just want to know.
So we are going to present a complete holistic healing program, which is what we have at our clinic.
So our presentation overview, we'll go over who we are, how we helped develop the South Beach diet, how we helped do TACK, which is the world's largest chelation study, how a book came out of that, how a movie came out of that, and then we'll go into our actual treatment program. What is holistic medicine? How we're able to find what is wrong with you. The biggest difference in holistic medicine and regular medicine is instead of just treating whatever the symptom is, we're going to look and try and find the cause. And we can usually find the cause. And then how we will work with you to improve your health. So Angelique is a board-certified anesthesiologist. She then did a subspecialty in pain management. She's a diplomat of the American Board of Holistic Medicine, certified in chelation. She's a former University of Miami professor and ran the VA, Miami VA Pain Center.
Roy is a board-certified cardiologist and he's board-certified in internal medicine. He's also a diplomat of the American Board of Holistic Medicine, chelation therapy certified. He is also a National Institute of Health investigator with a TACK trial, and he is a clinical assistant professor of medicine for the University of New Mexico School of Medicine. Also former chief medical resident at Mount Sinai Medical Center. So we come from conventional. We're no longer there. One of the things that kind of started into alternative looking into preventive medicine is the South Beach diet. At Mount Sinai, this is where Dr. Auguston, the writer, the author of South Beach Diet is. Roy was a chief resident at the time, and the cardiologists there were looking at a way to lose weight, and they decided that they had to investigate different diets and see what was the best. Was it the cardiology diet, or was it the Atkins diet? They wanted to find out what would be the best diet to tell the patients to use. So they asked Roy, who was doing a research project in the cardiology department, they asked him to please find out. And he did. He worked with a dietitian, came up with a diet, and then he had to present it for the first time. He had to present the results. And he said, well, Angelique, give it a name. It doesn't sound good what we're doing here. And he said, well, make it sexy, make it young looking. Call it the South Beach diet. And that's how it came about. Many years later, Dr. Auguston wrote a book about it, and he used different restaurants at South Beach to really bring the concept further. But Roy is the one that actually started this whole thing with a dietitian at Mount Sinai.
So from there, I graduated, and I was completely conventional, traditional Mount Sinai cardiologist. And actually Angelique started to look into alternative therapies through her pain program at the VA, and then she left the VA and opened her own healing center where she brought in a massage therapist and acupuncturist and started looking at different ways to do it. So one day in Fort Lauderdale, there was the first alternative medicine meeting of ACAM. And Angelique was going to go, and her uncle had come from Holland to visit us and to go to the meeting. So they're like, oh, we're going to go 4 days to Fort Lauderdale. Do you want to come? I was like, yeah, I'd rather be 4 days in Fort Lauderdale than working. But I really had no interest in the alternative stuff. So we go to the meeting, there's all these people, we're sitting at a luncheon, and I look over, and there's Dr. Lamas sitting there. I'm like, Dr. Lamas is the chief of medicine, chief of cardiology, one of the ones who helped start the South Beach diet. I'm like, what are you doing here? He goes, what are you doing here? Because there's like no traditional cardiologist there. And he goes, well, actually a patient asked me about chelation, and I said what we always say, oh, it's quackery, it's not proven. But then I thought about it, and I really didn't know. So I went to the library, I looked up, there was really no studies proving that chelation worked. So that's why I'm here, to see if we can figure out or set up some sort of study to evaluate if chelation does work. So you had a group of people on this side saying chelation's wonderful, and you had all the medical doctors saying it's quackery. So he loved that. That's what he loves. He loves to set up studies that show, sort of that controversy. So he designed initially a pilot study with 40 patients, of which we did the 9 patients of ours. And he actually didn't know anything about how to actually do chelation. So we actually did the chelation for the pilot study, 40 patients, 10 weeks. We showed that we could do it, and then he applied for the big government study. And so the NIH granted a $31 million, 10-year, 1,800 patient, 135 medical center study. Now it was double blinded. That means that we didn't know which patients were getting treatment, and the patients didn't know who was getting treatment, and the investigators didn't know. So nobody knew what was going on, and we didn't know the results all the way until the day it was presented. Dr. Lamas found out the results about 2 to 4 weeks before the presentation, but nobody else knew if it was, after 10 years of doing this, if it would work or not. But it was designed to once and for all prove if chelation worked or not. So what is chelation? Most people actually have never even heard the word. So chelate comes from the Greek meaning claw, and that's actually what it does. It pulls out the toxins. The body does not store toxins in the blood. If you get a blood level, it's usually 0. The body will store toxins in the fat cells, in the bones, in your brain, in your heart, anywhere. I always say it's like dirt in the middle of the floor, it sweeps it under the carpet. So there's never any, almost never any toxins in the blood. There are different chelators. There's oral and IV, and there's different ones for depending which type of toxic metal you're trying to pull out. The TACK trial studied EDTA. EDTA is the most commonly used, and actually right now if anybody had acute lead toxicity, right now, and you went to the hospital, they would chelate you with EDTA. It's FDA approved for lead toxicity. A child who suddenly gets lead poison would be treated with EDTA, like I said, FDA approved for lead removal. The thing is, they base it on blood lead levels. And like I said before, for chronic exposure, blood lead levels are usually 0.
So in the chelation bag, people always ask for it because it seems such a mystery. It's a bag with water, with this, saline, EDTA, magnesium, vitamin C, bicarbonate, which we use to buffer, and B vitamins. Some people add a few other things in there, but this is kind of the base formula.
So what did we find? So the first thing you'll notice is any articles you see on the news, when a newspaper reporter or any reporter reports on a study, what they're supposed to report are the results. And if you look online, you'll see that all the articles that have been published omit the results. And that is really bad because the results were wonderful. Overall, 26% improvement with chelation plus vitamins. 16% improvement overall in heart health. And what were the overall, when I say overall, what were the parts of that? So we looked at 5 different parts. We looked at diabetics. If a diabetic was in the study, did they have heart complications? Those were reduced 39%. That is huge. A 1% difference will get a drug approved for the FDA. Right now, all the statins that are prescribed are based from what's called the Jupiter study. The Jupiter study showed a 1% difference, from 0.5 to 1.5 difference in events. We showed 39%. And still, hospitalizations. If you were in the study and you received chelation, you had a 28% reduction in your risk of being hospitalized, 23% less heart attacks, 23% less strokes. Heart surgeries, stents, bypass, angioplasties reduced 19%, and death was reduced 7%. And it's completely safe. It was proven to be safer than Tylenol. So this should have been the reaction of people. This should have been front page, amazing news.
When the study was presented, it was presented very carefully. Dr. Lamas used words such as, this is a surprising result, astonishing. And so the American Heart Association made a statement right after the presentation, and they said, well, it looks like chelation therapy might show some benefits. Some benefits, 39% for diabetics, that's not some benefit. But it might show some benefit, but we are not ready to really recommend this therapy. We need to see more studies. And what went out to the press was exactly this statement without all these percentages. And that's what the press took out. And that was what was presented to everybody. So that is the art of making a point without making an enemy. With the TACK trial, we were not putting an alternative technique against an established technique. All the patients in the trial received the same medication. Everybody was getting maximal medical therapy. All our patients received a statin drug, aspirin, a blood pressure drug, and ACE inhibitor. Every single person. On top of that, half of the patients received a bag with the real deal. The other half received a bag with just water. So we weren't putting one against each other. We were adding something onto an existing treatment. And we were trying to be tactful.
So what happened? So, you know, we had waited years, 10 years. The original meeting with Dr. Lamas was 12 years before this November. And in November, when the results finally came out, I went to the meeting in Los Angeles, American Heart Association, 19,000 cardiologists in the audience. It's a 10-minute presentation. Dr. Lamas goes up. I don't know what's going to happen in that moment. Finally goes through the slides. His presentation's on YouTube. You can see it, and he presents 18% benefit overall improvement in chelation therapy. I'm like, wow, hooray! I turn around, nobody's reacting. I come outside. I call Angelique. We had prepared a book because I figured if the study's positive, the way scientific presentations are, it's very difficult to understand what it means. So if we have a book that sort of everybody can understand, I can put in the results, we can release it the next morning on Amazon. The next morning, I wake up, every article, New York Times, CNN, say, cannot recommend chelation at this time. The article's always published. When a study of this caliber is released, the article is immediately published. The article was not released. So I'm like, because Dr. Lamas did this huge study, I'm like, I'm going to wait on the book until he publishes his study. I thought a few days, and then we'll release the book with the article. It took 5 months for the article to be released. When the article was finally released, there was no media coverage of the results. And if anything, there were 2 editorials condemning the results. Again, there's a huge bias against chelation because it's this different thing. So we finally released the book, and it's actually available in front.
What happened was Santa Fe Soul is instrumental in the movie because we came here the weekend after the whole study was presented in November. And we were so upset. We went to the meeting here at Santa Fe Soul, and Shireen happened to be there, and Shireen is a filmmaker. And she saw our passion, and she saw how upset we are, and she realized this was really an injustice. So she decided to make a movie. So she came to our office, she filmed all of it, and here's the movie. So this is a little story. All right, we'd like now to start going to the second part of our presentation to talk about what we do. So who comes to us? Of a large variety of people with chronic disease. Heart disease, because Roy's a cardiologist, toxins, chronic fatigue, fibromyalgia, because I'm a pain specialist, cancer patients, patients with arthritis, anxiety, depression, brain fog, lots of patients with chemical sensitivities, thyroid problems, autoimmune disease, irritable bowel and GI issues, and chronic pain and headaches. This is just a small number of things that we do. Holistic medicine means healing the body, mind, and spirit. There's the Western traditional allopathic medicine, and then comes in alternative medicine, complementary, integrative, holistic. We use the names interchangeably, but we basically try to say we're looking at everything here. We're combining techniques and we're looking at the whole person. And I want to note that here, you can go doctor shopping and or which type of medicine you like. So the other thing that we would like to put up front is that when you come to us, you are not a disease. You are not the gallbladder from room 10, okay? You are an individual, and we want to know who is this person that comes to us? Why did this problem present in this person? That's really our interest. So we look spirit, mind, and body.
So starting with the body, most people, eventually the problems will present in your body. Even though they start usually on a spiritual level, then sort of on a mental level, but it will manifest in your body. And that's usually what brings people in first. And what affects our body the way we look at it? So toxins. The world is polluted. These toxins are in the air, in the water, in the food. There's electromagnetic radiation all around. And these toxins accumulate until the point that your body cannot overcome them, and that's where things start to show up. And the most sensitive part of our body is hormones. Hormone balance is really how our body functions, and toxins directly block the hormones from working. Diet, weight, exercise, fitness, posture, breathing, sleep, these are sort of where problems show up, but really from the base of toxins. The body will manifest what the mind is thinking. And the mind is tricky. So stress, there's underlying issues, trauma from childhood or just trauma at any time, depression, anxiety, brain fog, substance abuse, ineffective communication skills can manifest. The brain is set up in an interesting way. There's the logical part, but there's also what's called the limbic part. The limbic part is really your emotional reaction to stress. Anything that stresses your system, the limbic system will release a fear response. And that's where a lot of the problems come from.
The most important one is actually lack of self-love. In the end, a lot of times, this is where, during the conversation, during the intake conversation with the patient, when I touch that point is when tears come up. This is a crucial issue for a lot of people, lack of self-love. Spirit, finding your purpose. That seems to be the common theme for a lot of people. Sense of lacking connection. Following your order. Why'd you come here? What are you supposed to do? What is right? Is there a spiritual practice? And your spiritual practice could just be do some gardening, walk outside, go for a hike. That is also a spiritual practice. Are there past lives involved that have an effect now on this current one? And then unconditional love. That is the big word, unconditional love. Extremely important. We all have to learn that. We get it from our animals, but we have to learn it for each other.
So how do we examine you? So we provide an assessment. We do a very in-depth assessment. Like I said, we're able to find the cause, and that's really the key. So our initial evaluation includes all kinds of things. So we do a very comprehensive medical history. We basically want to know from your parents, your grandparents, how you were born, all the way through your life. We do a very complete physical exam. A lot of times people remark, you're the first doctor who's taken my socks off. I mean, you cannot get past the physical exam. You need to look at all the parts because there could be a little cancer hiding somewhere. So we're very key on that. We have a 3D ultrasound machine. Ultrasound uses sound waves to visualize all the parts of the body. So you can see if a cancer's starting, you can see if there's a blockage in an artery. The thing about like measuring cholesterol or CRP or all these other markers, to me, is outdated. We can directly see your arteries, we can directly see your organs. Why are we measuring markers of things when we can directly see it today? So, that's always a big thing.
Without radiation. So it's a very safe test to do.
even, yeah, I always joke with the whole mammography controversies. That uses radiation. If the mammogram's abnormal, then you do an ultrasound. Why not do an ultrasound first or thermography and just skip the radiation? Stress tests, we do 24-hour EKGs, oxygen levels, something very neglected. Most people at night have drops in oxygen level. You're not able to fully heal at night or rest if your oxygen levels are dropping at night. We look at, so again, coronary artery calcium. There's a type of scan you can do that directly looks at blockages in your arteries. You don't have to know your cholesterol, you have to know if you have blockages. Again, for us, a very big thing, toxins. We measure the 20 most common toxins. It's a urine test, looks at lead, mercury, arsenic, cadmium being the most, uranium for this area. We look at blood labs, including food allergies. Foods that might be good for everybody might be terrible for you. For example, I used to get this funny little rash on one side, and no one could figure it out. And it turns out if I eat broccoli, broccoli is great, but for me personally, I react to it, so I can't have broccoli. Urine, saliva hormone testing. The best way to measure hormones is in saliva. It gives you the levels, you want cellular levels of hormones. So saliva can look at cortisol, the most important hormone in the body, estrogen, progesterone, testosterone. We look at lung function. We have a bone density machine that uses what's called pinhole X-ray, so it's very, very low dose. And we can actually measure your metabolism on a special scale we have. So here's showing a few other things. So there's the ultrasound. I'm scanning my son. Stress test. Here's the bone scanner. Like I said, here, this is the type of scan you can do. You can actually see the heart on a CT. You can see the arteries. You can see if any plaque is starting. And this is ultrasound. So here you can see this is the artery of the neck. And you can see if there's some plaque buildup. I mean, anyone can see that. You know, you're not measuring a marker of something you might have. You can directly visualize a blockage in the artery.
We have some space technology that we use for as a lab. So we do look at cholesterol, because a lot of patients actually ask us for it. And interesting thing that people do not realize, when the HDL, the good cholesterol, goes really way high, that's a sign that the liver is working very hard to try to get rid of toxins. So when I get good cholesterol that's like 90 or 100, I know I have a big problem in front of me. I know that we're going to deal with a lot of toxins. Okay? So we look at, the homocysteine, we look at inflammation markers, and thyroid. The thyroid, we still have to look in the blood. I prefer to do it in the saliva, but the FDA has not been approving that. So for now, we'll still have to look at that hormone in the blood.
I just have to mention cholesterol. Cholesterol is not the cause of heart disease. Okay, everyone's told this whole story. It's not. Cholesterol originally, normals were more than 300, then it was 260, 240, 200, it'll be 180 in a couple years. Cholesterol is a marker of something else. If your body produces extra cholesterol, it's actually very hard to produce. It's 38 steps in your liver. And if your liver is producing that much cholesterol, it's needing it for something. And what it needs it for usually is cholesterol is the building block for all your hormones. So if one of your hormones is low, usually cortisol, cholesterol will start to go up. So we're always able to find the cause of your high cholesterol. So instead of taking a drug to cover it up, we find the cause and get that back in balance. Here's some of the special tests we do. Again, I talked about the hormone testing, the toxins, the food sensitivities. We also have gut testing. A lot of people, oh, I'm taking all these vitamins. How do I know if they're working or not? And there's actually a way to measure. There's a blood test that measures your intracellular vitamin levels. And you can see, even if you're taking what appears to be the right levels of vitamins, maybe they're not getting in your cells or you're not absorbing it fully. So you can measure and see, you can adjust, or am I getting too much of something? That's a good way to fine tune it. 23andMe is an amazing new thing that just came out. It's a $99 test. It measures your entire DNA genome for $99. So you get a complete printout of all your genes, if you're more or less susceptible to the 20 major diseases, where your ancestry came back, all the way back to caveman times, where your genes came from geographically, like Asia, Europe. 23andMe DNA, $99. Just online, it's like their own company. Yeah, Google 23, 99 bucks. It's from the Google people. And then brain, this is me wearing an EEG. We have a way to map your brain. We also have a way to measure, actually specifically measure brain function and measure neurotransmitters, which is actually an area I'm very interested in. So how do we approach it? We call it the high five approach. So we look at toxins being the most important. I always say if you're still toxic, no matter what else you do, it's like driving with the handbrake on. It's never really gonna work until you get rid of those toxins. You balance your hormones, what to eat, exercise, and then head and heart being the biggest part.
Can you actually do pre-Alzheimer's?
Yeah, we can measure people sort of where they are on a scale, the end being Alzheimer's, but are you starting to sort of lean that way, let's say. So what are the tools we use to heal? So definitely detoxification. If you have toxins, there's no toxin that helps you. People always ask me, oh, what's a normal level? I go, 0. No poison helps you. You want your hormones, in the neighborhood at least, what to eat, exercise, and rest. Rest is a forgotten part of this formula. You need to rest. Then, there's layers of psychological and spiritual things. We work with chakra balancing, energy medicine. We teach how to meditate. Kriya Yoga is how we were taught. Stress management, and then what we call the Jumpstart program.
This is a specific program. People come from out of state and stay with us and do this on a daily basis. They might stay for 3 to 5 weeks. Or local people come every day, just without staying with us, but they come every day. What we do is we have IVs, either vitamin C or chelation or combination. We do EWAT, which we're going to explain to you in a moment, which is extreme oxygen therapy. Heart math, which is a brain-heart connection. ECP, another thing to increase circulation as well. It helps us with detox, I'll explain in a moment. The far-infrared sauna, we have something called a Biocharger. We use a John blood crystal healing bed. There we have a massage therapist, a Qigong master, and he does also energy healing. And we have a counselor, and also he does spiritual counseling. So the vitamins doesn't hurt.
We numb the skin.
I numb the skin. I'm an anesthesiologist, so everything is done with lidocaine. IV vitamin C, IV glutathione, and IV chelation. Those are the 3 IV modalities that we use. I want to show you real brief the IV glutathione because people do not realize how important this is. Glutathione is in your lungs, in your liver, in your brain. It's used for cleaning up. And there's this doctor here in Naples, he's a neurologist, and he's been using glutathione pushes for Parkinson patients with really amazing results. So we're going to show you here, this is off YouTube, what happens to this gentleman before he gets the IV shot and right after.
Stop and turn around.
So you can see here he's pretty advanced Parkinson's. He has trouble speaking, very difficult time walking.
Sometimes that can stop putting my legs up. Turn around again. I'll just walk that way, okay? Now we can have you stop and say to you okay? Yeah. Today is a sunny day? Today is a sunny day. Good job. Okay. All right. Go ahead. Walk on down there. Go. Big steps. Go.
So here he received 30 minutes of IV, 30 minutes later, he received 3,000 milligrams of IV glutathione over 10 minutes. And 30 minutes later, you can see the improvement in how he walks, and you'll hear him speak.
Turn around. Come on back. I feel a lot better. A lot better. That was about a half an hour ago we gave the glutathione.
Yes, so depending on where the underlying cause is where you see how long the effects. So the effects sometimes can last up to 3 months off of just one shot. But again, the key is to find, what caused the Parkinson's. Usually toxicity, usually mercury or lead. And then by removing that, then he won't even need the shots. He's basically just over to heal.
All right, go ahead. Let's. You still recording? Let's see how he looks.
So this is EWAT, extreme oxygen. So here you can see the oxygen concentrator. There's 2 bags. There's a 100% oxygen reservoir, and a high altitude 13% reservoir. That's the oxygen at the base camp of Mount Everest. And what you do is you start walking on the treadmill breathing 100% oxygen. You then switch to high altitude oxygen. Normally the arteries and capillaries aren't fully open. When you switch to the high altitude oxygen and you start running, those capillaries and arteries open 100%. You then switch back to 100% oxygen, and that oxygen floods through your body. When you think of hyperbarics, for example, hyperbarics are forcing oxygen through your skin to raise oxygen 2 to 4 times. This is raising it 10 to 20 times in your body. There's parts of your brain that haven't seen oxygen in a while. And if you think of, they always say you only use 20% of your brain. Well, why is that? And the reason is because your brain is so metabolically active that there's not enough oxygen to go around. And this is able to open up those capillaries, those venules, so you're able to use 70, 80, 90% of your brain. So people that have brain fog for years, boom, just opens up just like that.
This detoxes you because when the cells are getting full oxygen, when all these capillaries are open, and everything starts working together, cells that haven't been able to participate are going to open up and they're going to dump their toxins. So in the beginning, we have to be doing this very carefully and slowly because patients will get a detox effect if we do too much at the first time. This has been really successful in opening up a lot of things and improving patients that were stuck at a plateau. We add this, they have a next benefit.
Our next thing is HeartMath. HeartMath is a biofeedback system. So people always tell me, oh, I'm not stressed. Actually, when you hook them up to the machine, it measures what's called heart rate variability, which is a marker of stress. And almost everybody's 100% stressed when they first hooked up to the machine. I've done maybe 2,000 people, and I've only found 2 people who live non-stress levels. So, but what's neat is this shows you a technique where basically you feel your heart, you breathe in and out through your heart, imagine, and then you think of something really nice. And that technique is able to shift you from what I call a stress response to a non-stress response. Or the other way to look at it is we always live either we're aging or we're healing. And this is able to shift that. And what's really cool, I think now, they've come up with an iPhone app where you can actually walk around with this thing most of the time and see during your daily activities what triggers you into the stress response and how quickly can you get back of it. HeartMath. HeartMath.
Kirsten is going to talk about this in a little bit too.
Yeah. Next is ECP. So that's me on an ECP machine. What ECP does, it's a series of blood pressure cuffs on your legs, and as those squeeze, it creates what's called a percussion wave. This is an FDA-approved, Medicare-covered therapy that nobody knows about. It's been around for over 20 years. It actually came from the Soviet Union, and it's able, when you think of healing, you know, how does healing occur? If you think when you break a bone, they put it in a cast, but how does it actually heal? The doctor doesn't do anything, he just holds it in the cast. What happens is stem cells come in and heal your bones. Stem cells are what repair our body. ECP is able to boost your own stem cells 800%. So stem cells have gone through an evolution. Originally they were using fetal cells, then they were using bone marrow cells, now they're using fat cells that they pull out and activate. You have stem cells. They are in you, they're just not active. If you broke a bone, they would work because it's such a traumatic event. But for chronic disease, they've sort of fallen asleep. And the combination of ECP to activate your own stem cells and then the EWAT, because the stem cells run on oxygen in the plasma, are able, like I said, 800% boost in stem cells. And I think that's how we've seen some of the sort of miraculous kind of healings we've seen.
At the end of the day, we usually want patients to go into the sauna. It will help to get rid of all the toxins because we're kind of shaking the tree. All the toxins are getting out of the cells. They're in the bloodstream. It has to get out through feces or with the urine, but it can get out to the skin. So before you go home, we put you in our sauna and help you get rid of some of the stuff that we got out of the cells.
There's also raising your core temperature also has some anti-cancer research supporting it. Also boosts your metabolism. A lot of people have very low metabolism.
So how soon after you do one of those treatments do you have to get into the sauna?
Yeah, so the best is just all in a row. You come in, you hook up the IV, you do the Biocharger, you do the EWAT, you do the heart math, you do the ECP, and then we pull out your IV's finished, and then you go right into the sauna, 15 minutes. And that's really the most effective way. Biocharger, our 6 cells, or cancer cells, if you see here on the bottom left, they run on a voltage of around 15 millivolts. A healthy cell is going to run around 55, 70, and a healing cell is going to run around 100 millivolts. No one in medicine has really looked at this. And a way to boost the energy of your cells, they developed, actually Tesla developed in the 1800s, a Tesla coil, which is a way for your body to absorb energy. A lightning bolt would work also, but it would kill you. So it has to be a slow way of your body to absorb energy. And he figured out a way, there's several of these devices, and it's a way for your cells to absorb energy. The first thing a healthy cell is going to do is dump toxins. Your body knows that toxins are bad. It just doesn't have the energy or the ability to clear them from the body.
So again, this has been very effective. We have to be very careful. In the beginning, we only put patients there for 3 minutes. If it's too long, they'll tell me, I'm feeling detoxing. I'm feeling the effects. This is how I know this works. John of God crystal bed. Most of you know who John of God is. Yes, but John of God is a healer. He brings saints come through him, and he helps heal people. He is in Brazil. He has a lot of crystals that he's sitting on, that he works with, and he has received information from the masters to make this device called the crystal bed. There are crystals placed over all the chakras. There's a light going in front of each of these crystals that represents the chakra colors, and there is a frequency machine connected to this. So we put you under this machine, and it's amazing. Some of the patients that tell me that have not been able to respond to anything, they really open up. They start opening up. Something shifts after they get exposed to the crystal light bed. It's been an amazing journey to learn to work with this. Who works with us now is Kevin. He is he does spiritual healing and energy healing. He gives Qigong classes, and he's a massage therapist. So he now started working with us, and it's been a wonderful relationship. Reverend Paco is a Catholic priest. He has a master's in counseling. He's also a spiritualist. That's what we call him Reverend. And he's been extremely powerful, because when he was working as a priest, he used to do confessions. So he's heard it all. There's no secrets. And so we ask our patients, especially when they come for an intensive program, to really get exposed to all these different aspects. Because there's always something where we might get stuck. And a lot of times, in the end, it is a very deep underlying issue. That the sooner we can get it on the table, the better we can work with this and really clear it out and really jump up to the next stage towards the healing process.
So, I mean, what's amazing to me about him is that he was a United States Marine, then he became a Catholic priest for 16 years, and now he's a counselor. So if you talk about perspective, the guy is just amazing. So we have a Labyrinth. This is the Labyrinth at our clinic. It's our daughter, Karina, our middle one. So Labyrinth is another way, sort of a meditative practice also as you walk it. You know, it takes like 10, 15 minutes to walk it. It's pretty powerful too. Sometimes you'll have great insights as you're doing that. So next we'll talk about eating. This is food. You see there's no package, there's no label. It was picked from something. They haven't messed with it. That's food. That's what you eat. Okay? Fruits and vegetables. It's very simple. Eggs too. We like eggs. We think eggs are the perfect food. It's not true, that whole cholesterol story. Next, juicing. You know, we loved the juice lady the other day. We've worked a lot with the Gerson sort of philosophy. This is our juicer. It's called the Norwalk. I only mention it because I looked into juicing. Any juicer will work, at a certain level. What's sort of cool about that one is that, so on the left, you put the fruits or vegetables in there and it actually masticates it, which means it sort of grinds it, chops it up. And then on the right side, this is like a press. So you put it here and it goes up and it just squeezes it. What you're left with is just the fiber. And it basically removes all the juice out of whatever you're juicing. So they did measurements. You get 4 times the juice from any carrot or whatever you're using and 4 times the nutrient. So it's the most effective way to juice. That's why I sort of mentioned it. And then Angelique's favorite.
This is my favorite. So we call this star butts. We're talking about coffee enemas. And coffee enemas, they're fantastic. They really work. Why? The coffee goes straight from the rectum to the liver. And there are 2 ingredients in the coffee that induce in the liver an increase in that glutathione production, at least 7-fold or more. Which means the moment you use the enema, you hold it in for 10 to 15 minutes, your liver cranks up glutathione, does a major detox, a major cleaning house, and then the caffeine helps the gallbladder to squeeze it out back into your colon, and 10 minutes later you will sit on the toilet and all those toxins come out with everything else. The energy that one gets from this is a very stable energy. It's not like a coffee jitter. It is a very sustained, stable feeling throughout the day. I highly recommend it. That depends on what you're doing. If you're doing a juice fast and you're doing, mostly juicing, you want to do more enemas, maybe 2 or 3. If you're doing it for a day. If you're doing it for regular maintenance, you do it a few times a week. It depends how aggressive or what kind of program you're doing. For myself, I do it about 3 times a week. Keeps me going. I jump out of the bed and I'm ready to go for all day.
So you need to exercise. Just as you need to breathe, you need to exercise. I'm sorry, there's no way around it. So definitely, the most important thing in exercise is do something you like. Nothing versus something is an 80% benefit. It's all right there. I mean, the easiest thing you can do in the morning, run out your front door as fast as you can. You can only run, how long can you run at full speed? 5, 10 minutes? And then walk back. That is good. That's enough to start. If there's some sport you did when you were younger, go back to that sport. Your body has muscle memory that will remember how much you used to like doing this thing. If you used to play tennis or golf or whatever, go back to that. Those are the sort of the 2 core things. The second thing is rest. Meditation is like super rest. So we were taught Kriya Yoga in India. I think that's the most sort of effective way to heal of all the ones I've found. But again, rest is very important. The first thing, the Old Testament in Moses, the first thing Moses was told when he was freed was the 7th day, the day of rest. If you think of God built the universe in 6 days and he rested and we don't rest, okay? So God needed rest, take your rest. I think some of the other speakers spoke about tolerance, I believe it doesn't matter what you do. Pick whatever you want, but stick to it. If you were born into a situation, that's probably going to be the easiest for you because it's just sort of built into you. But if you want to go a different way, that's good. The key is more the commitment into what you're doing more than what you pick. And that's even true with diets. Diets, they looked at the 4 major diets: Weight Watchers, Atkins, low fat. It didn't matter which diet you followed as far as how effective it was. It mattered how much you stuck to whichever diet you picked. And I think that's just how it is. So where is our bar? My bar is not to not be sick. My bar is as high as it can go. For whatever reason in my life, I've been just lucky to meet all these people. So my first spiritual if any of you have read Autobiography of a Yogi, the first guy I met, suppose he's the Mavatar Babaji from that book. Now, I didn't know anything. I mean, when I tell you I didn't know anything, you cannot believe how much nothing I knew. I wasn't against alternative. I didn't know it existed. I wasn't against spiritual. I didn't even know it was there. I did not know what the word chakra meant when I went to India the first time. That's where it started for me. So Norm yesterday, that was amazing. I mean, he doesn't like to be called the grandfather of holistic medicine, but he is. I mean, he's the father. He invented the word holistic. So for to spend time with him was just amazing. This is the real Patch Adams. I got to spend a week with him. He dresses like that. He dresses like a clown all the time. He walks around. So for me to see that it's okay to be that far out of the box was a big sort of eye-opening thing. Eckhart Tolle, he almost never gives talks. He gave one talk in Toronto, I heard. I went, and it was him and his partner, his wife, and I always love to tell a story about that. So, it's 3 days with him. I mean, there was 15 people there. So you're in that field, and what I thought the coolest story I heard was, so when he was already enlightened, and she met him, and she thought, oh, okay, I'm with Eckhart, I'm going to be like awesome. Of course not. And as she met him, she tried to pull him into her little, oh, you're lazy, you didn't do the dishes. And he'd go, I'm going for a walk now. So I thought that was really cute. We got to meet Dalai Lama. This is in Brazil, Rio, India, Washington, the lowest energy place we've been to on Earth. So basically our goal, or I've seen what's attainable by these these amazing people. So that to me is health. It's like that's where you can be at, and that's really what we're striving for. Here's our clinic, so you can see the front. It's Angelique's office, my office. Here's where you come in. Here's the chelation room. We have a greenhouse. We have organic gardens. So when people stay with us, they eat all organic. We have 27 chickens. So for the eggs, and we definitely invite everyone to come and experience all the different things we have to offer. We also offer a program for out-of-town guests, where up to 6 guests can stay in our luxurious 3-bedroom, 3-bathroom guest home. Specifically designed for patients with multiple chemical sensitivities, especially hypoallergenic.